Hello and welcome to The Take. I'm your host, Chesley McNeil. Each weekday, we're looking at stories, making headlines, and bringing experts from our community to give their take. Here's a look back at some of the top takes from this week and how those in the know are seeing those stories that impact you. Georgia's booming hemp market is taking the state to court. Retailers say the new rules from 21 and over limits to bans on smokable flowers and some THC drinks could crush them. Here to offer more of a take is Deanna Petrone, owner of the Hemp Haven with locations in Atlanta and Decatur. Deanna, welcome to the show.
Thank you so much.
All right, let's start off with this. People who hear hemp and think marijuana, give us the 10-second explainer about the legalities and the THC levels on that.
Well, the difference between the hemp and the marijuana plant is that marijuana has high THC, low CBD, and hemp produces a flower that has high CBD and low THC. And usually most of all the products made in Georgia are using the hemp plant, which was legalized in the 2018 Hemp Farm Bill.
On the lawsuit, from the lawsuit's perspective, how has these new rules changed the average week in your shop?
Well, let's see here. We've had a considerable amount of revenue drop since October 2024, about 40%. It's been pretty stark. We've had to reintroduce a new way of consuming hemp products to our customers. So we've had to try to teach them how to drink products and also use tinctures and more gummies versus smoking. So it's just been real difficult because we're having to re-educate the customers on a new way of ingesting.
Yeah. Is there one particular restriction that hits you the hardest?
Well, let's see. The fact that we lost our flower was a real major thing because we get a lot of people from out of town that come from these legal states and they're looking for, some relief. They're traveling through Atlanta and then they find out that there's no flower and they need to figure out some different alternatives. Also, they made the gummies. They lowered the dosage on the gummies to 10 milligrams per gummy and only 300 milligrams in a bottle. And so that can be a little difficult for people that are dealing with chronic pain because they're using strong medications like oxycodone and morphines, and pain medications are very hard. And so that milligram of Delta 9 hemp, it does not translate well. It's not strong enough for someone that's dealing with surgery or dealing with a knee pain or a back pain. Yeah. So it's a little difficult because the customer has to ingest more product, which becomes a lot more expensive.
So what's the immediate relief that you're hoping the judge grants here, and what would you be able to do today or tomorrow that you can't do today?
Well, the immediate relief would be to be able to have flour back into the stores. That would definitely bring back our consumers and our customers that are opting to go to the black market to find questionable products versus coming into the stores and purchasing a product that is Georgia compliant.
If the court doesn't pause this enforcement, what's plan B for you? Would you have to do something as drastically as shutting down the business?
Well, plan B is we focus on education. We have been able to, we're teeter and tottering along. We're not planning on closing down, but definitely it is a lot harder and we might have to start finding a way to pivot our business into some other type of industries. But hopefully Hemp Haven is going to stand strong and we're going to do our best to be able to provide these CBD services to our community for as long as we can.
Yeah. If you had 2 seconds, right, you should tell a lawmaker sitting in front of you right now, you had 2 seconds to tell them of a good fix, what would it be?
Well, the most important thing for our lawmakers is to be educated on what CBD products are and how they're helping the community. My suggestion is to go to your local CBD stores. We're located in Avondale and in Chamblee. Pass by the store. All of our employees are very educated. We give free CBD classes. to any customer that comes in. And so that's the best way to learn about how these products affect people and how these low dosages, they're expensive products and they're low dosages. And so if you're dealing with some type of ailment in terms of medical surgery or things like that, it's kind of going to be hard to get those strong products. So we
Mhm.
urge them to just come into the store and get your education so that you can know what can work with you.
All right. Deanna Pardone, thanks so much for joining us. Really appreciate it.
Thank you and have a great day.
All right. 11Alive did reach out to the State Attorney General's office. Their statement, simply, we're reviewing the complaint and we will continue to defend the law passed by the General Assembly and signed by the governor. Imagine graduating from high school not just with a diploma, but a $1,000 investment portfolio in your name. That's what every senior attending one of 3 high schools in the Athens area will be receiving upon graduation. That's what they'll get as a present. Here with more is Interim Superintendent of the Clark County School District is Dr. Jennifer Scott. Dr. Scott, welcome to the show.
Good morning. Thank you for having me.
All right, talk to me. How did you pull this off? How does this program come to your students?
Wow. So this came to us back in March from one of our content coordinators, Ben Smalley, whose brother Logan is the founder of TED Ed, and he works directly with Gifted Savings. They piloted this program in California at Westbrook Academy, and they were looking for a school district to take it on as a pilot district wide. And he immediately thought of us, his alma mater. So we were excited to be given the opportunity and immediately jumped on how can we make this happen for our students and our community.
Yeah. How do you see this program shaping the students' futures, financial futures beyond high school?
Yep. So it's more than just giving them $1,000. It's truly providing them with the knowledge and the education around what it means to invest those funds. And I think that that's the key part to this partnership, that it's not just about handing over $1,000 investment portfolio. With that comes a year long of learning for financial literacy purposes to build their capacity to understand all aspects of investment, those high risk, medium risk, low risk, so that at the end of the year, and these portfolios are turned over to them upon completion of the financial literacy program, they are truly educated and empowered to act on what it means to invest your funds, to save, to really plan for the use of those funds and ensure that it's providing for a prosperous future for you as an individual, but also for you as a family.
Yeah. What message does this send to the community about investing in our young people?
I think that anytime we invest into our young people, we're investing not just into them, but into our community, into the future of our communities, ensuring that we are prepared to be prosperous for perpetuity. So when we're looking at providing them with that education, then it's truly giving back to the community as a whole. It's not just our individual students. We're thinking about what does it look like long term for the future of our community.
Have you heard from some of the students about this opportunity? What they had to say about it?
Oh, they were excited. The day of, there was just great excitement to announce it. Somehow we were able to keep it a secret from them until the actual announcement. So it just felt great to see their energy, see their levels of excitement. They asked some amazing questions to really begin to for themselves to understand this opportunity that was being presented. And I think that for them, it's how can I then have control over that investment? For this first year, they will not be able to make any selections over what's being invested. They will all have identical portfolios that they're able to watch and they're able to learn from. And then once those portfolios are turned over to them, they will be able to make those choices themselves. So that's what I'm hearing from a lot of them, that they're excited to have that turned over to them, but to do it being educated on how best to utilize those funds.
When I first heard about this program, I was thinking, wow, I wish I had that when I was a high school senior. Were you thinking the same way?
Absolutely. I was thinking as a senior myself, I was thinking for my own children who are now in their 20s that this would have been great for them. So it's never too late to learn, though.
Wow, man. I'm thinking like, how would my life have changed by now if I had this opportunity? So hopefully they are really appreciating this, as you said. Could this be become a defining part of the school district's identity, a defining part of the school district identity?
I think that it can, because it provides us with an opportunity to really begin to instill in our students that this is something that they can look forward to when they become seniors. It becomes a highlight for them as seniors within the school district. It also supports our families in them preparing their students to really engage in this learning and to use it for their future and for to use it wisely as they're thinking about how they might begin to really invest even beyond the $1,000 that's being provided for them. But this is something that we're looking to endow within a 5-year period. Gifted Savings has done a very generous donation for this first year as well as the second year, but we are looking to our community to continue to support this so that we can be in a space within 5 years to truly endow it so that it does live on in perpetuity for all students that go through the Clark County School District.
We learned that the damage from Friday's attack on the CDC headquarters was much greater than we first thought. Two sources within the CDC referred 11Alive to an internal meeting which detailed at least 181 bullet holes found in 4 buildings and a guard shack. Fortunately, no CDC employees were physically harmed, but a DeKalb County police officer, 33-year-old David Rose, was fatally shot while responding to the scene. Health and Human Secretary Robert F. Kennedy Jr. paid a visit to the CDC headquarters. Later, Kennedy visited with the DeKalb County Police Chief and met privately with the widow of Officer David Rose. Secretary took to social media to issue a statement saying, "We are deeply saddened by the tragic shooting at the CDC's Atlanta campus and took the life of Officer David Rose. We stand with his wife and 3 children and the entire CDC family." There have been 21 permanent directors of the CDC since the agency was created back in 1946. Today, we are bringing in one of the past directors to share his thoughts on and emotions on what took place over this past weekend. Joining us now is Dr. Thomas Frieden, who has served as the CDC director from June 2009 to January 2017. Welcome to the show, Doc.
Great to be with you, Chesley.
All right. First of all, give us your reaction of what happened, when you heard what happened at the CDC this past weekend.
My heart goes out to the family, friends, and colleagues of Officer David Rose and to everyone at CDC. We stand with you, we honor your service, and we hold you in our hearts. It's a horrible thing to see people who dedicate their lives to protecting others come under attack. And I think this is a moment to step back and say, whatever you believe, reject violence, listen to others, especially others you don't agree with, and let's figure out to turn down the emotional volume some and to move forward together, because this kind of violence doesn't solve anything. It's a problem, it's not the solution, and we need, as a society, to be able to listen to each other and to respect each other's beliefs.
Yeah. Doc, talk to me about the culture inside the CDC, and did you feel safe when you were there?
Well, I'll tell you, when I was CDC director, every epidemic intelligence service officer and hundreds of other staff responded to the Ebola outbreaks in West Africa, the world's first Ebola epidemic. It was a very stressful situation, and the president of Liberia, one of the 3 affected countries, President Ellen Johnson Sirleaf, said to me, when all the rest of the world was running away from Liberia, you and the rest of the CDC staff were running toward us to help. And when I thanked one of the many CDC staff who had been there for months working, what he said to me, I'll never forget. He said, I want to be able to tell my children what I did in the war against Ebola, just as the older generation is proud of what they did in World War II. So seeing the attacks on people who are there to protect us is really terrible. We need to protect the people, health workers, public health workers, who protect us. That's essential for all of our health.
Yeah. We're hearing that the suspect reportedly acted upon some false beliefs about vaccines. How big of a threat is health misinformation to both the public trust and safety? And are you shocked that it turned deadly?
Well, on the one hand, we really don't know what all of the shooters' motivations were. We do know there are a lot of falsehoods out there. And some of them, unfortunately, are coming from Secretary Kennedy. many of the things that he says are simply not true. It's okay to have your own opinion, to say, I don't want to get this vaccine, or I don't trust the data, but making up things and saying things that aren't true, it doesn't help anyone. And we really need to try to get back to where you can disagree about opinions, but we should be able to agree on what's certain and what's not certain in the facts. But I think the more important issue here is just to emphasize that we stand with the people of CDC. We mourn for Officer Rose and his family, and we hope that this will be a turning point to turning down the violence. We have seen enormous attacks on public health and healthcare workers all over the country. It's a real risk. It's a risk not just to people doing those jobs, but it's a risk to the people who those people protect. It's a risk to all of us when we don't allow our health workers, whether they're nurses and doctors or public health workers, to do their jobs. We are less safe.
Yeah. And what lessons should lawmakers take from this incident when considering funding for public health security and outreach?
Well, safety first. We have always said in public health entities, safety first. Our staff need to know that they are safe when they do their jobs. And whatever that takes, we need to make sure it happens. There is a certain irreducible risk. There are certain things you can't avoid. If you go into an outbreak zone, you might get infected, though we take every measure possible to minimize that risk. But certainly the people who dedicate their lives to protecting the rest of us shouldn't have to worry about being attacked for doing their job.
Have you ever had an insurance claim denied? Well, you know the frustration and the fight it could take to get it reversed. And now, a new kind of ally is stepping in to help. We're talking about artificial intelligence. Here now to share how this tech works and whether or not it could change the balance of power between patients and insurers is Neil Shah. He is the CEO of Counterforce Health, which helps people write insurance appeal letters with AI for free. Welcome to the show, Neil.
Thanks for having me, Chesley. I really appreciate it.
Not a problem. All right, what made you decide to take on insurance appeal process and offer it for free?
You know, I went through a multi-year cancer journey taking care of my wife. And, the hardest part of the whole thing was actually fighting the insurance companies. And then later, I've been running a caregiving platform helping tons of older adults across the country get care. And I'm seeing the same thing, kind of out in the field. A lot of people are fighting health insurance companies when they're taking care of a loved one through serious illness or disability. And I think it's just an absolute tragedy. So I kind of thought, okay, what can we do using our skills and modern technology to help people fight back? So that was really, the origin of the idea.
Gotcha. How does AI actually build these letters out?
Yeah, so what happens is when these health insurance companies deny your claim, you got to go through a lot of medical records. You got to go through your policy coverage document. You got to upload things. Like, it's hundreds and hundreds of pages. And to take a regular person to do this, which I've done, would take 8 hours, 10 hours of work. Some would take 5 hours to write all this stuff. The way our AI works, and this was kind of a fun project that we built, is you can upload all your documents and it will parse through them, and in less than 2 minutes, it will give you a very well-crafted letter. It is trained on billing code databases. It's trained on successful appeal strategies from a lot of state insurance regulator databases, and then it keeps learning over time. So not only can the AI do in 2 minutes what it might take you 8 or 10 hours to do, it can actually do a better job. So 70% of people are winning their appeals. And I think that's just like a really cool thing, for people to have at their disposal.
Yeah, I was going to ask you, what kind of success rate are you seeing so far? And so you just mentioned that. How quickly are the denials being overturned?
Sometimes same day. Believe it or not, we even have clinics using it. And by the way, forgot to mention, the tools are completely free to use. We are a social impact organization, fully grant funded, so we don't charge people a dime for this stuff. And, I think it's a human tragedy what's going on, all these people having to fight back against health insurance. So completely free use. Individual patients are sometimes winning same day, next day. Clinics are using it, and they're sometimes winning same day. So it's really cool to see. If you write a really well-crafted appeal letter, you have a good shot of winning. Oftentimes it's like an administrative error by the insurance company, or sometimes they're just testing and doing it on purpose to see if you'll actually respond and fight back.
Wow.
So doing this in 1 or 2 minutes really eases the burden on a lot of people.
Have you noticed certain types of cases where AI is specifically effective?
Yes, AI is very effective in medication denials. So a lot of times people are denied access to critical medications. Whether it's rheumatology, autoimmune disorder, whether it's oncology, cancer, other needs. A lot of times medications will be denied, because they'll want to see more evidence, more proof that you actually need it, especially if it's like a second line treatment. So we're seeing high efficacy in that. So I'd say oncology, neurology, rheumatology, we're seeing very, very high.
Some insurers are being accused of using AI to deny claims. Do you see this as a AI fighting AI kind of a situation?
I do, sadly, and that's really why we built this. So I actually wrote about this. I put a book out, Insured to Death, and I'm happy to send to anyone if it's free. So just email us and reach out to us. But I wrote an entire book on what's going on. Health insurance is using AI to deny people programmatically, sometimes in like as little as a second. No one's even reviewing this stuff. So if you have to write a letter and it takes you 8 hours or 10 hours, no wonder people are not going to fight back. They're going to give up. So I think that it hasn't caught up yet, and that was really our mission: is how do we build tools to kind of arm the resistance? It is going to be AI versus AI. And, if you're writing it manually yourself, it's not a fair fight. So we're very passionate about this. In the book, I share a lot of appeal strategies. Again, happy to give it to people for free. Just email us or reach out to us. But, our mission is that we think the field has been tilted towards insurers. And, denial rates have gone through the roof over the last few years. Some people, there's 25% denial rates at some of these companies. And, an interesting statistic is over 1 in 5 adults in America have been denied a health insurance claim over the last year. So it's kind of, I personally think this is ridiculous. What's the point of having health insurance if when you get sick, you get denied?
While this action today is unsettling and unprecedented, I can't say that given some of the rhetoric of the past, that we're totally surprised.
That was Washington, D.C. Mayor Muriel Bowser just reacting to President Trump's move yesterday to take over the district's police department and activate 800 members of the National Guard in hopes of reducing crime. Here now to offer more context in this move is Emory political science professor and friend of the show, Andrea Gillespie. And welcome back to the show, first of all.
Thanks for having me.
All right, so what makes this this move of legal status that the president has to directly assume control over the police force?
Well, DC is in a special state because it is not surrounded by a state. So it is not part of an existing state. So Atlanta is part of Georgia. You would expect that the governor would intervene if there were something terrible happening in Atlanta first. Washington, D.C. as a federal district has its own special status. So we all know that D.C. doesn't have voting representation in Congress. It doesn't have senators. It only has a delegate, not a full voting House member. And so its budget and its oversight is overseen by the federal government. So Congress provides its budget. Congress has committees that oversee what's happening there. And in the case of emergencies, based on the 1973 Home Rule Act, the president has the right to be able to intervene. So that's why Mayor Bowser couldn't say that she was going to resist this takeover, because she really isn't in a place legally where she's able to do that.
The president called on something called the Home Rule Act as a reason for this move. Tell us what that is, and does it allow him to call the National Guard for this reason?
Yes. So the short answer is yes, he can call the National Guard for emergencies. So I think that, if there's going to be any contestation over this, it's going to be whether or not the carjacking of a former Doge employee actually rises to the level of an emergency. This is not to minimize any crime issues that are in D.C., but those statistics are in dispute. And if we look at the National Uniform Crime Reporting data that the FBI puts out, crime has started to go down on most violent indicators since 2023. The question is whether or not that happens soon enough, because in the United States, overall, most sort of crime peaked in recent eras around between 2020 and 2022. So there's this larger issue of how data is being interpreted that I think we can get into. But basically, before 1973, DC was run completely by the federal government. They couldn't elect their own mayor. They couldn't elect their own city council. The Home Rule Act enabled that. So for those of us who, were little at that time or were born after, we don't know a DC that hasn't been able to elect a mayor, but that has actually only been around for about 50 years. And so DC has autonomy, but when they mess up, Congress can come in and intervene. And so we saw this during the mayorship of Marion Barry, that DC's finances were taken over by a control board board that was put in place by Congress. And so now what President Trump is saying is that the crime situation has gotten so out of hand that he needs to be able to call in the National Guard for a month to get them to engage in policing activity.
Yeah. What should we be watching for in the coming weeks to gauge whether or not public opinion sees this as an effective way to govern?
So, I have no doubt that the national news outlets are going to include some type of question like this in surveys. So, we should see the fruits of that in a couple of weeks. I also want to see what happens. We want to see whether or not President Trump actually makes good on his threat to try to take over, policing in other cities. So he named a litany of cities like Baltimore and Oakland and Chicago and New York, where he was like, this could be coming to you. It's a lot harder for him to do that in state or in cities where there are states with governors. He would have to do something like he did in Los Angeles, and that's being litigated right now, where he has to say that the mayor and the governor are kind of derelict in their duties and not addressing a situation. And so I think that, if that were to happen, we would likely see litigation. And I think that there could be some litigation here about whether or not crime, as horrible as it is actually warranting sort of the definition of an emergency. But now that we are where we are, I think we want to see if crime rates fall further sort of in this coming month compared to previous months or last year in particular. And as somebody who has lived in Washington, D.C. before, I know that the crime rate varies depending on what part of the district you're in. Mm-hmm. I'm paying attention to Ward 7 and Ward 8. So that's the southeast part of the city. That's where there's typically been high crime. So, does this initiative actually make things better there, or does it make it worse? Right. So I think that there are a lot of things that we could be looking at.
Well, this week, a battle of words over the nation's handling people who have been detained by U.S. Immigration and Customs Enforcement, or ICE. A new report from the U.S. Senator Jon Ossoff from Georgia alleges that widespread abuse in ICE detention facilities. His office cites 510 credible abuse reports since January of 2025, covering physical abuse, sexual abuse, neglect, and unsafe conditions. Vulnerable populations allegedly affected include pregnant women, children, and detainees with medical needs. The Department of Homeland Security countered the report of Senator Ossoff's office with a lengthy statement saying, in part, all detainees are provided with comprehensive medical care, proper meals, and given the opportunity to call their family members and attorneys. These are false allegations. All these false allegations are garbage and are part of the reason ICE agents are facing a 1,000% increase in assault against them. Joining us now is Midikar Valencia, the executive director of El Fugio, the nonprofit which works with families visiting people detained at Stewart Detention Center outside of Lumping. Welcome to the show.
Thank you. Thank you so much for the invitation.
Absolutely. Let's start off with the group and what does it do for families?
Yeah, I think what we are seeing, this report, but also what we have seen the Stewart Detention Center matches the narrative, the stories we hear from loved ones, the people that we visit at the detention center. They routinely go under abuse, neglect in this facility, and of course, we have documented that over the years. The report the Senator Ossoff published recently is just one of the evidence that the system has been created so much harm in our community, especially those who are impacted by detention and vulnerable population, as you mentioned.
Yeah, you see the realities up close and personal with these detention centers. What's some of the most things that people outside don't realize that these families have to go through?
Well, families who have loved ones detained go through immense, obstacles just to visit their loved ones at the detention center. Visitation is very restrictive. We at the facility have been able to see many families. We have seen a huge increase of families visiting at the detention center, and that allows us to do more services. But at the same time, people are most likely have less ability to provide for their loved ones, for the community. Their loved ones are detained. That brings a lot of economical challenge for them. But when loved ones also are dealing with medical issues inside of the detention center, that also brings a lot of fear in the community. A lot of, what if my loved one, suffers something inside of the detention center? What if the person gets, is sick, and then it probably won't get the proper attention they need at this facility? I think one of the experiences that through the pandemic, but also today, we hear for family members is that, just the overall fear that something can happen to their loved one, that they could die in detention and no one will do anything for them.
Yeah. Mr. Valencia, you've probably seen the Senator Ossoff's report on the alleged abuse at detention centers and then DHS's strong pushback calling those claims false. From your vantage point, what do you make of the back and forth between the two?
Well, I think it's a reality. I mean, the reality is that the victims here is not ICE agents being facing backlash in the community, is the people impacted by immigration detention. They are the ones who, throughout the years, unfortunately, is not something new. Issues of, abuse and neglect, overcrowded detention facilities are not new. And of course, we have seen it overcharged and supercharged in this administration. But the real victims here are community members. They are the ones who are attacked while they're in the streets, while they're doing the work. And then when they are in detention, they face all of these obstacles to even to communicate with their loved ones. Sometimes people are just disappear from the system. Loved ones are not able to even communicate with them. We have received calls from loved ones who saying, I can't find my loved one in the system. I don't know how to communicate with them. They probably don't know my phone number. So sometimes pass days and sometimes weeks without any communication, knowing what is happening to them. And when some of them are facing, as mentioned before, medical issues inside of the detention center, families are not notified that your loved one is dealing with this, that your loved one is being transferred to the hospital, that your loved one is dealing with all these issues. They deal with all these abuse and neglect alone in the detention center. And sometimes there is reports like who has reported, there's many organizations have reported all these issues. Yeah. I think it's very clear for people to understand that this is a systemic problem, and the real victims here is the community members who are impacted by detention, who are currently detained.
Okay, let's face it, child care is expensive, and Fulton County is testing a way to ease the burden for its workers. Let's bring in Fulton County Chairman Rob Pitts to explain a new pilot program underway and what it could mean for the future there. Welcome back to the show, Commissioner Pitts.
Great to be with you again.
All right, now let's explain this program first of all.
Well, let me go back to the beginning. I think it was in April of earlier this year in April where I put legislation before the board to develop and create a pilot program that would provide child assistance, child care payments, a reimbursement payment for our employees who would qualify. Because the thinking here was that, most of our workforce is female. That's number one. Number two, every report that I had read at the time said that one of the deterrents to people working, women working in particular, was the cost of child care. So I'm thinking that, well, if that's the case, we need to address that issue. Because I was thinking back that when my daughter was little, we spent $1,000 a month. And that was back, some 25 years ago. Fast forward, it's really, really expensive now. So that's number one. What can we do to provide some assistance? Number two, at any point in time, our main building here, 141 Prior Street, is half empty because people are working from home. Some always say getting paid from home, whether they're working from home or not. That's another story and a discussion for another day. But I thought that as an enticement to getting them to come back to work, if we could provide child care. And so it kind of grew from that. So fast forward, again, the original legislation introduced in April of this year. At our last Board of Commission meeting, the board agreed with me and approved unanimously this pilot program. It would be a 6-month pilot program through the end of the year. There will be a lottery for people to participate in. And we did a survey, but I'm leaving this out. We did a survey to determine whether or not there would be any interest in the program. And we were shocked at how widespread the interest was in it and still is. So that's what led to it. Again, 6-month pilot program. It will be retroactive until July of this year through the end of the year. And if it's successful, and I have no doubt that it will be, then we will look at it from the point of view of funding it going forward, beginning in the 2026 budget. They will be reimbursed up to $500 per month for those who qualify. So I'm excited about it. The board is excited about it. And more importantly, the employees are excited about it.
Well, I
So
bet.
that's what we are.
Yeah, I bet. You talked about helping families with this program, also bringing employees back into the office. Is it also used as a tool to attract more talent to your area?
Absolutely. Because, because child care is a problem.
Yeah.
And also, we talked about it as well. We'll have to see how this plays out because, like, for example, in our jail, most of the people in that jail who are working there, many of them are females. And my thought was, well, what if we were able to provide child care in close proximity to that jail? Because the jail is open 24 hours a day. If we could provide child care, close proximity, adjacent to that jail, just think how attractive that would be for, again, primarily females, but there are also men who are responsible for child care.
Yeah.
What a wonderful thing that will be, and that's in the works as well.
Yeah. Now we understand you have like 100 spots available. Is that correct?
That's correct.
All right. So how do you select or have a process that's fair and equitable for employees across all departments?
It'll be a randomly drawing. And those who qualify will be put in a bowl, a fish bowl, I guess. And I will be there picking out the 100 names, and whoever wins. Because I mean, the demand is going to be much greater than the resources that we have during this pilot program period. Yeah, you have no doubt you have people in your area that have unique child care needs. How do we ensure that they're not left out of the program? Well, there'll be a priority for those who have like special needs cases. We're going to come up with a way to take care of them as a priority, as a matter of fact. You think, and it sounds like this program is going to be successful, right? And I have no doubt about it. So you'll make it permanent, I guess, throughout the county for employees, right? That's correct. Okay, so that's again, it's also all depending on what the 2026 budget looks like. But the pilot program will be successful, and that will be a compelling argument, I think, for the board to consider this going forward. What was the feedback, particularly? You said it was overwhelming. You did a survey. It was overwhelming success. You thought, you got more than what you thought you would get from employees as far as wanting this care. What was the specific feedback that they gave you? They wanted it. They liked it. Thought it was actually long overdue, and they were thrilled that the county would be, again, Fulton County, I always say we're a big deal. We're a very progressive top county, one of the top counties in the country. We're always a leader, and I think this, again, if this is successful, it'll put Fulton County, Georgia, once again at the forefront. Yeah. So you think it'll serve as a model for other counties in Georgia, right? Absolutely. Absolutely. If you didn't know, August is all about wellness, but the American Red Cross says that starts with rolling up your sleeve. During the National Wellness Month, this month right here, they're urging people to donate blood, especially as supplies are running low. Suzanne Lawler with the Red Cross joins us now to talk about why your pint could be the healthiest gift you give all month long. Suzanne, welcome to the show.
Hey, I really appreciate it. Thank you so much.
No problem at all. Let's get right to it. How critical is blood supply right now?
Well, critical, blood supplies are not running low, but let me just tell you, the Red Cross supplies 40% of the nation's blood supply. And every 2 seconds, someone in this country needs blood. So just in this few moments that we're going to be talking, numerous people will need blood. The Red Cross is happy to roll out A1C testing again this month, in the month of August. And this is absolutely free when you come in to give blood. A1C testing measures your blood sugar levels over the last 3 months. It is really a litmus test on prediabetes and diabetes.
Suzanne, you said, and we hear this, every 2 seconds someone needs blood, but what does that look like in the real life? Make that live for us.
Well, the people need blood. Think about this. Traveling down 75, one trauma accident, someone could need 100 pints of blood. Your blood donation, which is one of the most altruistic things that you can do, can help cancer patients, people living with sickle cell, and even premature babies. Yeah. What happens when a hospital's blood supply runs too low? Well, the elective surgeries may have to be canceled. I mean, we're not at that point. The blood supply is strong, but we need folks to come in. Think about this. Only 3% of people that can actually give blood give blood. So I talked to a lady, her name is Sandy Lee. She was dealing with kidney disease. And to put this in real life situation, She said that once she got a transfusion, she immediately felt better. We have blood drives all over the state, and I've been to many of them. I'm a blood donor myself. And I can't tell you the number of people that come in and say, my family member needed blood, my neighbor needed blood, and it was there on the shelves. And that's what's important. The Red Cross is here to make sure that that blood stays on the shelves, and we can't do it without our generous donors.
Yeah, there may be some folks out there that may be unsure. Talk to us about who's eligible to donate and how often they can do it.
Yeah, fantastic. You know, you can give blood every 56 days. So that's, you know, like once every 2 months. Let me take you through the process. So I want to talk about the blood donor app. You may say, hey, I don't need another app on my phone, but the blood donor app is going to make it super easy for you to give blood. You can answer questions on the app. I'm just going to put it up here. It is free.
Absolutely.
Wherever you get your apps, the Red Cross blood donor app. And what I love about this app is that a couple of weeks down the road, you're going to find out your blood type. You're going to get your results for that A1C testing, and you're going to find out where your blood goes. My last donation went to Canton, Georgia. I had a colleague in Atlanta, and her blood went right down the road. It's kind of another attaboy, like another pat on the back a couple of weeks down the road. If you don't want to go with the app, no problem. You can always go to redcrossblood.org and make an appointment. And here are some things that you need to keep in mind if you're going to make a blood donation. You know, hydrate well, eat a good meal, especially rich in iron, and get a good night's sleep.
Yeah. I remember hearing that O negative or O positive was the type that was badly needed. Is that still the case?
Yeah, absolutely. You know, O negative is the universal blood type. We were talking about that trauma situation. O negative blood is something you don't need to know your blood type. Surgeons can immediately pull that off the shelves and use it for anyone. So we need everybody to come and donate blood, but especially folks with O positive or O negative.
Yeah, I think I'm O positive. I think I am.
Oh, well, you need to come in and make an appointment now. Get that blood donor app.
I think the last time I did it, I did a double. They did a double one. Is it always a pint that they take, or how much will they take at a time?
Yeah, it's a pint too. And keep in mind too, with the A1C testing, this is for platelet donors and plasma donors and blood donors. Now, if you've already gotten an A1C test already this year, then it's only one per year.
From tuition to trade school, Georgia's Path to College 529 plan is turning small savings into big opportunities, and new rules making it more flexible than ever. Bethany Wetzel, with the State Treasurer Program Director, joins us now to explain how. Bethany, welcome to the show. Welcome back to the show.
Thank you. Great to be here.
All right. For families who've never looked into a 529 plan before, how would you explain it to them in simple terms?
Okay, a Path to College 529 plan is a tax advantage way for families to save for college that allows them to take advantage of several tax benefits and allows earnings and savings to compound over time.
So with the Path to College, it's often ranked as amongst one of the lowest cost 529 plans in the country. How do those low fees make the difference over time?
Well, I mean, the lower the fees are, the more money that you're going to be saving in your account. And so as that extra money that you're saving by having low fees is going to compound and grow tax-free and tax-deferred. And so the more money you have available to save, the better, of course. You got some new features this year. Talk to me about those. Yes, some really exciting news in the 529 space. HR 1, more commonly known as the One Big Beautiful Bill Act, was enacted in July, and it has expanded Path to College and 529 fund usage. Specifically, and kind of most excitingly, K through 12 expenditures have expanded to include educational therapies for individuals with disabilities, such as occupational therapy and speech therapy. It can now be used for tutoring outside the home, educational classes outside school and home, and for standardized tests such as AP exams, SAT, and the ACT. And then additionally, it expanded the use to include expenses for credentialing programs. So now licensing fees or credentialing programs, anywhere from getting a forklift certification to getting a CPA license, those funds can be used to help maintain or gain that credential. And then going back to the K through 12 expansion, starting January 1st of 2026, now tuition will increase to $20,000, where you can use $20,000 on K through 12 expenses going forward instead of $10,000. So we've got an expansion in the amount that can be spent on K through 12, the expansion of how the funds can be used. We've got an expansion of how they can be used for credentialing expenses.
Wow. Yeah. How is this been a game? How is this going to be a game changer?
So I think for Georgia families, it's going to be a game changer in that I think typically savers who were saving for K through 12 were those who were going to private school. And now with the additional uses for those funds, now those individuals that have students that are going to public schools will be able to use those funds for additional items. So it just really broadens what can be used from tuition and really is a game changer for families who want to seek additional educational opportunities in K through 12 for their loved one.
All right, you got a student that decides they're not going to college. What are some of the options for that money?
Well, that's okay. So one, Path to College expenses or 529 funds can be used not just for college or the traditional 4-year or graduate school, but they can be used for vocational school, for apprenticeship programs, and also for technical school. But if someone chooses not to pursue a post-secondary option, the funds can be transferred to another beneficiary. I have a friend who had a Path to College account and she had funds left over and she was able to transfer those to her daughter when she was born. So that's great. Funds can be used by a sibling to pay off student loan debt, and funds can be used to roll over to a Roth IRA established for the beneficiary. So there's lots of options if someone doesn't use those funds. And then of course, an individual can always just withdraw the funds, but there will be tax implications if they're not used for those other disbursements.
Those of you used to hearing a dial tone followed by some static and then hearing, "You've got mail," will soon be a thing of the past, like everything else, right? For over 40 years, AOL has offered dial-up internet service, but that will come to an end on September 30th. The hum and whirl of a dial-up modem was the first for many of us to connect to the internet. It peaked, the company peaked at nearly 10 million customers. That was in the mid-90s, but new technologies, faster speeds made dial-up a thing of the past. Believe it or not, they still have some customers on that, right? The company reporting the low thousands. And not enough to keep it up and keep it going. Pretty soon it'll just be a memory, folks. Out of here. You've got mail. I'll never forget it, of course. Maybe we'll never forget it. Or who knows? The next technology will make us forget it. That's all we got for you today, folks. Make it a great one. Try to encourage someone to, loose that AOL account. Get a Yahoo account. Oh, that's old too, right? Google's the thing now. Enjoy.